what abnormal uterine bleeding is. Abnormal uterine bleeding is simply any change in the menstrual frequency, duration, or volume, which means that either it is too heavy or too long or irregular. And secondary amenorrhea is the absence of menses for more than 3 months if woman had regular periods before, or more than 6 months absence of the menses if she had irregular cycles previously. This is the definition of secondary amenorrhea. So you have two criteria. If you have a woman with the regular periods previously and now she's not having any period for for 3 months, for more than 3 months, you label it as secondary amenorrhea. But if a woman is having a history of irregular menses and now she is not having periods for more than 6 months, then you label it as secondary amenorrhea. So once you have established that patient is having abnormal uterine bleeding or secondary amenorrhea, the next step is always check the pregnancy. Always check the pregnancy regardless of the patient's age. The first step in any woman with a missed period or irregular bleeding is order a beta HCG to rule out pregnancy. Then the next step is if age is less than 45 and HCG is positive, which means the patient is pregnant, so you will manage the patient accordingly. But if the HCG is negative, then you will proceed to the hormonal evaluation. You will check the FSH, TSH, and prolactin levels. Basically, if FSH is high, it will represent ovarian failure or premature ovarian insufficiency. If TSH is abnormal, it might represent a thyroid disease causing menstrual irregularity. If prolactin is high, it can represent prolactinoma or drug induced hyperprolactinemia. This will help you to identify the most common endocrine disorders of abnormal uterine bleeding and secondary amenorrhea in a woman of reproductive age. But if the age of the woman is above 45 or 45, then you can still start with beta HCG to rule out pregnancy, although very less likely, but you still do the beta HCG test. And after that, if beta HCG is positive, it will be a pregnancy, and if it is negative, then because usually no further hormonal evaluation is required in most of the cases, because menstrual irregularity in this age group is usually due to perimenopause. However, in selected cases, we can check TSH or prolactin to rule out galactorrhea or thyroid symptoms if there are galactorrhea or thyroid symptoms are present. Clear?